Common movement adjustments. Starting positions. Starting positions. Every exercise's starting position should aim to remain as relaxed as possible. If the body is tense before practice, the body will likely become even more tense as the movements begin. However, this doesn't mean the body should be completely relaxed. For example, when lying supine, in a supine neutral starting position, you must maintain pelvic, scapular, and spinal stability. After mastering the 5 basic principles of Pilates, you can transition from this to a more relaxed posture. Maintaining the stability of the starting position is crucial in every exercise. Whether the body is lying supine, prone, seated, or side-lying, the body must remain stable. Keep the body steady before movement, as each starting position remains unchanged. Many practitioners need to adjust their starting positions to reduce tension and relax the body. Supine. In the supine starting position, the pelvis is neutral, with the lower back in a neutral position, and the arms are typically relaxed along the sides of the body. In this position, the scapula, shoulders, and hands should maintain relative neutrality to the pelvis and spine, meaning these 3 areas must remain in neutral alignment relative to the upper body. If the head tilts forward, making it difficult to avoid bringing the shoulders forward, practitioners should consider lifting the head with additional support. For those with forward head posture or significant neck tension, a cushion under the head may help maintain neutrality. Proper alignment can prevent excessive neck strain or overextension of the cervical spine. If individuals have shoulder pain or neck tension, this modification may be necessary. If there is excessive cervical flexion where the neck is overly strained, training in a supine position with the head and shoulders elevated during abdominal preparation may reduce neck discomfort. Keeping one or both arms placed behind the head can provide additional support while reducing neck tension, allowing the scapula to relax. This type of modification can reduce discomfort in the neck muscles, prevent additional strain, and facilitate better abdominal engagement. Both legs raised, knees bent at 90 degrees, or both legs angled upward. Raising both legs, bending the knees at 90 degrees, is a starting position for supine, prone, seated, and side-lying positions. Raising the legs at 90 degrees involves flexing the knees and hips, with the thighs perpendicular to the ground. This degree of flexion helps maintain core stability. On the other hand, if maintaining a 90-degree position is too challenging, a 45-degree angle with the thighs is also effective for this type of exercise. Whether in a neutral supine position or during the abdominal preparation practice, this adjustment is helpful. In the supine position, both legs in the raised position involve flexion of the hips. However, do not forget to maintain spinal and pelvic alignment throughout the exercise. The abdominal muscles must engage to stabilize the movement and prevent excessive pressure on the lower back. Both legs raised, knees bent at 90 degrees, or legs angled upward raising. Both legs with the knees bent at 90 degrees or angled upward can help maintain pelvic and spinal neutrality in both neutral and imprinted positions. Regardless of the position or exercise, the pelvic and lower back must remain stable, and the abdominal muscles should remain engaged throughout. Seated in a seated position, the cervical spine should maintain a natural curve, with the head positioned directly above the shoulders. If the head tilts forward excessively, or if the head shifts toward the shoulders, it indicates that the body is overly tense, and this requires adjustments in the seated position. When seated with the legs extended forward, the pelvis should generally maintain a neutral position. Additionally, some practitioners may sit with the legs crossed or sit with the pelvis tilted forward. In either case, sitting on a soft cushion or bolster may help lift the pelvis and bring the spine and pelvis into a more optimal position. Side lying. The side lying position must be performed with careful alignment, depending on the alignment of the pelvis and the balance of the body's muscle structure. Some practitioners may need support under the lower side of the body, with the legs slightly separated, hip-width apart, to maintain a more stable posture. Pillows, bolsters, or other support objects may be placed under the pelvis to relieve tension or discomfort, aiding in stability. Leg alignment. Using objects like bands, balls, or foam cushions between the legs can help maintain proper leg alignment. Even if the legs do not stay fully pressed together, this adjustment will allow for inward and outward adduction. Similarly, placing support outside the legs can help facilitate outward rotation. When outward rotation is needed during an exercise, the outward rotation of the legs can better target muscles of the buttocks and outer thighs, while inward rotation focuses on the inner thighs. During practice, practitioners can choose which rotation to emphasize based on their goals and body structure. Exercises that involve outward rotation in a supine position help relieve tension in the muscles surrounding the hip joints, but ensure that the proper rotation is achieved to avoid excessive lumbar spine extension. Movement adjustments. At all times, adjusting the movements and the starting position ensures that each aspect of the practice, such as best positioning, tension release, movement mode, muscle recruitment, and exercise goals, is effectively implemented.